Subcommittee, excuse me, to order, and so let's get started on time today since we got a heavy agenda, and on this committee work day we got a lot of committees ongoing, so if we can sort of keep us on time. We'll start off with the Veterans Service, so the floor is yours, and thank you so much for being here.
Okay, thank you, Chairman Watson. Members of the subcommittee, good morning. I'm joined today by Assistant Commissioner Mark Bannister. Behind me is Assistant Commissioner George Canavaggio and our budget analyst, Kamala Ball.
I think this is online, so if we can bring those mics a little bit closer and maybe chairs up a little bit more, and so everybody can hear in the room. You're talking to us, but we got an audience behind us and maybe
Yes,
even
sir.
some people online, so thank you so much.
Okay, is this better? Okay, moving on to page number 2, that's just a reminder of what our mission is. Our mission follows our 3 program areas, so assisting our almost 700,000 veterans and their families with compensation, pension services, all from the Department of Veterans Affairs, our 2 skilled nursing homes, and our 2 state cemeteries. Just so you know, this morning the VA released their asset and infrastructure report. Georgia is their #1 market, so we are expected to grow, and they are proposing $56 billion in funding for the state of Georgia, with 7.5 of that to be capital improvements. So just to let you know that just hit the street. Quickly going through slide number 3, that's our overall budget, and I'm going to go into more detail. Starting on slide 4, you can see overall our budget includes the efforts the state is making towards talent acquisition and retention. GDVS has some of the lowest paid employees in state government, so this $5,000 raise is going to be a tremendous help for us. Overall, our budget for administration includes the cost of living increase, leave withdrawal, changes in the employee retirement system, insurance, and teamwork, and these changes will go through each of our programs, so I'm not going to brief them again. Moving on to page 5, specifically our Georgia Veterans Memorial Cemeteries. If I could first thank the House for their support to add an additional ground maintenance technician as our internments of veterans and their family members continue to increase year over year. We were provided an additional position for our Milledgeville Cemetery last year and are very grateful that our need for an additional worker in Glenville was supported in the House budget. Combined with the overall cost of living raise, we believe we'll finally be able to recruit and retain staff in our cemeteries. Moving specifically to line 357.4, that $1 million is actually a matching contribution by the state for a proposed cemetery in Augusta. We've been assured that's going to be in our budget next year, as we're still trying to get on the VA's priority list for that cemetery. Moving on to page 6. For our Georgia War Veterans nursing homes, as you can imagine with the pandemic, we had overall a reduced admissions in the 2 homes. The good news is we have started admitting again. For 2.5 weeks, we've had no positive COVID cases. And since we last briefed these slides, our census has increased. So right now, we have 120 veterans in our Augusta home, which is up 4 since I last briefed you, and 158 in our Milledgeville home, which is up 3 since I last briefed you. And this date is as of the 4th of March, and they do test all through the week. Moving to page 7, our veterans benefits, which is where the majority of our personnel reside here in our department. Most of them are at the salary level of $27,000, so the cost of living increase is very appreciated. We're also appreciative of the House, including a new suicide and prevention coordinator position, as we are part of the larger governor's challenge across the nation. And this will help our veterans needing mental and behavioral health services, and we needed a full-time position to coordinate this very important program and to build relationships with our community providers to help reduce veteran suicide. So thank them for that. Moving on to page 8. We're very appreciative of all the work that the Governor and the General Assembly has done on our budget. We do have 2 needs we'd like to talk about today. We've seen tremendous attrition this year, to include 10% just in the month of December alone. So we are hiring to support our department and the veterans here within the state of Georgia. And when the funding for the cost of living increase was calculated, it was based solely on our then encumbered positions as of July. And of course, we have been diligently filling our positions to support the veterans here in Georgia. And we believe that somebody that joined our team after July of 2021 should also get that $5,000 cost of living increase. So that impacts about 14 positions in our department, and that was the total cost if that $5,000 increase was to be allowed for those people that have joined us since July. Moving on to page 9, this one's probably a little bit very important for our department. So we've been working with the Human Resources Agency as part of the Department of Administrative Services to complete a market analysis on our positions. And they concluded that our veteran service officers, who are the majority of our department, they're about 90% of our personnel, were under the state minimum salary for their job classification by $2,973.63. So we're asking that those lowest paid employees be considered for an additional $3,000 raise so that they are within the state salary standards for their positions. Additionally, when comparing our salaries to our surrounding states, we are the lowest paid. They make between $10,000 and $20,000 less than service officers in Florida, Mississippi, South Carolina, and North Carolina. And as the General Assembly, of course, passes landmark legislation designed to make Georgia more veteran-friendly, and we attract more veterans to the state of Georgia, it's important that we retain qualified individuals. We calculated the cost for training of one individual over the first 6 months with us, and it equates to about $20,000 in man hours, where we have a senior manager training the individual. That makes them unavailable to assist our veterans. So ironically, when you look at our reductions in this program in 2020, the cut we took is almost equal to what we're asking for to give the additional raise. On the next page, page 10, to sum, when we first entered this budget cycle last year under my predecessor, we had 8 priorities for funding. But we found some internal efficiencies to include moving positions to new offices that are co-located with the VA's community-based outpatient clinics, to include those in Pike County, Wake County, and Cobb County. So we're going to be able to do that internally with our organization. So we do only have those 2 additional requests, provide the cost of living raises to our then vacant positions, which we're now filling, and to increase our lowest paid employee salary by additional $3,000 so they are no longer under the minimum wage for their position. Just to wrap up on slide 11, as a reminder, we provided over 250,000 services to our veterans and their families last year alone. Of the $4.3 billion brought into the state for veterans compensation and pension, $3.8 billion of that is directly attributable to our department and our team. This results in our Veterans Benefit Program having a return of investment of about $380 for every dollar that the state spends. So pending your questions, that concludes our subcommittee brief.
Do you have any questions? Number
1 in your heart, number 10 on the dial.
You know, that's, I don't think so. I think you're over there number 3, maybe. How does that sound?
That sounds like an old.
I want you to keep Bernice number 1. Thank you, Mr. Chairman. I apologize for joining a minute or two late. I had the wrong room number on my calendar. So you said you had, thank you for your presentation. It was very thorough. I love it. You mentioned that you had 14 new hires since July of 21.
July, sir. Yes, sir.
Talk to us about, that begs the question about turnover. What is the total number of employees?
We've got about 163 employees in the department. So we had 16 turnover just in the month of December. Overall, for last fiscal year, we were fairly low. During COVID, we didn't see a lot of turnover until this winter. And many of them actually were hired away by another state agency, making $20,000 more than they did with us.
Shut your mouth.
Yes, sir. I won't tell you who, though.
Yeah.
But doing a similar job.
Okay.
They're very well trained, excellent team, when we'd like to keep them.
Okay. So competitive salaries is the major issue?
That is the major issue.
Okay.
Yes, sir. They make just over $13.
Yeah.
And
That's,
An
that
hour?
budget request, what line is that in?
Okay, so this is an additional ask for the $3,000. The line item was for the $5,000 cost of living.
359.1.
Yeah, 359.1 is for departmental administration, and then the majority of our folks actually fall under 359.
page 9.
Veterans benefits, page 7. And so 359.1 was that $5,000 pay increase. But even with that $5,000 pay increase, according to HRA, we're still underpaid and are below the minimum state standards for our position classification.
How much are you asking then?
An additional $3,000 per employee for the year. And so that ends up being the request on page 9. If you were to take everybody in our department that makes under the $50,000 a year, the total would be just about $652,000.
Mr. Chairman,
Follow up there. Sir.
if I may, just an observation. When there's a lot of pie, everybody wants a piece, and they all fight over it. When there's no pie, no fights. Budget's a whole lot easier when we're broke.
Yes, sir, and today is Pi Day,
And
so
we've
I
been
like
there
your
both times.
reference.
It is March 14th, Pi Day.
Yeah, Pi Day.
2 years ago today, remember what happened?
That's right.
Governor Kemp declared Georgia a state emergency. The president declared it on March 13th. So thank you. I have another question here. Chair of the Veterans
Just
Committee.
two quick things. Thank
Yes,
you for
ma'am.
your presentation. One is just for the committee's benefit. I expect we're going to probably next year be dealing with a bigger ask on the nursing home side because we are having a study committee on our state veterans homes, hopefully during the summer. And then the second thing is just a question on the suicide prevention person. That's in addition to the person that you have right now doing outreach and wraparound and
Right now, yes, ma'am, that would be an additional person. It's an additional duty for our Women Veterans Coordinator, and that is a full-time job, and she is having to do this part-time. And suicide prevention takes a full-time effort, and we really need somebody to do that. So I appreciate the House actually adding that into our budget.
All right, lastly, you started out your presentation with, and I don't think everybody was here. Would you mind recapping that and sort of going into that a little bit about the X amount of billion that you were saying was coming in?
Yes, sir. Just overall, so the state of Georgia brings in about $4.3 billion a year in benefits, compensation, and pension through the VA. That goes directly into Georgia's veterans and their surviving family members. $3.8 billion of that is directly attributed to our department. So our individuals out in the field helping these veterans and their family members apply for these benefits. So it ends up being about a $385 to 1 return on investment just based on that program. They're our kind of first line of defense. They do a lot of customer service and helping our veterans, trained to the level of a lawyer. So it takes a lot of training to get somebody competent in that position, which is why attrition is such a big deal for us.
Thank you so much. All right, Senator Orrock, number 1.
Thank you very much.
Whoa,
Three,
whoa, whoa,
actually, it's
whoa,
number
whoa.
3 on your radio dial.
Yes, ma'am.
The point you're making, if I'm clear, is that the federal dollars that come into our state's economy, because when it hits those pocketbooks of the veterans and their families, it is, of course, spent right away. It's not over in some bank accumulating interest, right? So it's a direct infusion into our economy if
Yes,
we
ma'am.
adequately fund the outreach capacity of the agency to work with these veterans to get them signed up to receive these monies. Is that?
Yes, ma'am. Absolutely. That is a very accurate characterization.
Thank you.
Thank you so much. I don't see any further questions. Thank you for your presentation so much. And we'll next with the Office of the Child Advocate.
Thank you very much.
And then we're at, after that, it's Department of Human Services. Thank you so much.
Thank you. Good morning, Mr. Chairman. Can y'all hear me okay? This doesn't seem to be. Is that working better? You want me to move? Let me try this one. Is that better? Oh, that's better. Yeah, there we go. All right. Good morning, Mr. Chairman and members of the committee. Thank you so much for having us here today, and thank you so much for your consideration of the Office of the Child Advocate on our prior request to this subcommittee regarding the amended budget. Because the issues involved that we presented to this subcommittee regarding our amended budget overlap so closely with those in our ongoing request, I'd like to save the committee some time. I know y'all are very busy schedule. Just by hitting the highlights of the slide presentation you have in front of you. As I pointed out last time, just to refresh your recollection, if you look at slide number 7 on your outline sheet, you'll see that in most recent years, the Office of the Child Advocate has coped with a lack of personnel and dealing with the issues regarding child welfare investigations across the state by primarily really screening out the majority of cases that came into our office. I think one of the mandates that I had when the governor appointed me this summer was to come back in and reorient our office to its statutory purpose. And because of that, we've realized that it's very difficult to do with our current resources. That's something that neither our office nor the legislature, the governor's office, or OPB was really aware of until we began this work of reorienting and really prioritizing our investigations of state agencies, primarily DFACS, working with them collaboratively to try to solve the problems that result in bad outcomes for our children and families in foster care. And so that's how we came to sort of see our needs going forward in order to address our basic statutory mandate. So you can see from our most recent pie chart slide in 2021 that previously the agency was screening out almost 75% of all of the complaints that came to our office. And as a former SAG representing DFACS and as a former juvenile court judge, I was aware that that was far too high a number and that most of these complaints probably did merit at least a cursory investigation, but they were just being screened out. So we've begun to really focus on the complaints that we get from the public and from other constituents, including legislators, CASAs, judges, basically everybody involved in our child welfare legal system. We have also worked very closely with the Division of Family and Children's Services on helping them to troubleshoot the reasons behind child fatalities for children who are touched by DFACS. That child fatality work is reflected in slide number 8. You can see that that's been increasing steadily over the last several years. In 2021, 2 investigators out of our 4 investigative staff were tasked with helping with that very important work, and the 2 of those investigators handled 112 child fatalities. Remember, this is not just child fatalities across the board that like the GBI child fatality review committees look at. This is just child fatalities where the family was receiving DFACS services or DFACS was involved in them, either ongoing or recently. So we've had a very large uptick in our office's assistance to the Division of Family and Children's Services with helping them to review the circumstances of child fatalities and serious injuries and trying to prevent those in the future by making recommendations for systemic improvements. The other thing that we've done in order to focus on the systemic improvement side is looking at areas of the state. This is reflected in slide number 9, where we have continued complaints of the same variety coming from certain areas of the state, whether it's a county or a judicial circuit. And we've reinstituted a practice that some of my predecessors had of conducting county audits, where we take our most experienced senior investigator who then pulls cases from DFACS files fairly at random, but representing all the different stages of DFACS work with families. We review those to try to find common denominators and elements that would lead to these consistent complaints coming from certain areas. So we've had 2 county audits going on currently, and we've got probably 3 more in the bullpen waiting for the resolution of our 2 current. Those 2 that we have currently have added 16 cases to each of our investigative caseloads already. So my mandate to my office to really refocus on our statutory duties and to really dig down into what's going on when we have complaints about agencies working with children and families in our state, or even with court difficulties, because sometimes the court difficulties overlap with departmental difficulties. We found that we're really stretching our capacity to the limit and beyond our limit, actually. So we have made the request to support us ongoing with more investigative staff, our ability to deploy our investigators back into the field again, to support them as they travel through the state, to do court observations, to meet with DFACs and other parties in those cases, to do file reviews, and to watch court proceedings so that we can really get to the bottom of some of these things. And we've asked for some technological updates to update our computer system, our data processing system, our case management system, all of which thankfully has been supported by both the House and the Senate in the amended budget, and we're asking for that capacity to continue that going forward. So our total request going forward to support this enhancement of our ability to do our basic job is $380,785, which is reflected on slide 11. Happy to answer any questions that the members of the committee may have, Mr. Chairman.
Too much coffee.
It's 178.4 in our tracking sheet. And Senator Allwright?
Thank you, Mr. Chair. On the county audits, thank you for your presentation, and you pulled it together in a very cogent way. But the county audits, is that when you've gotten feedback? What flags a county for county audit? Is that where the agency in place there is? You're getting complaints about them, or just walk us through that for a second.
The criteria are internal to my office. It's basically a situation where we receive a complaint regarding the same maybe county or judicial circuit again and again and again. We start to realize we're seeing the same thing over and over again, and I'll authorize a county audit in that case. So we'll go in and pull, trying to find out why we're getting so many complaints from a single source.
Yeah, thanks, because then we hear that too from actually counties where I don't live or represent, but somebody knows me and they reach out.
Yes, ma'am.
Thank you.
I think that's part of our 2-pronged goal. We want to help individual families and individual cases by troubleshooting the things that are keeping those families from achieving the best outcomes they can. But at the same time, we want to be able to extrapolate that experience to systemic improvement. What can we do to stop these kind of things from happening in the first place? That's really the role of the county audits.
Thank you so much. Very important position, and I'm glad the House added that in, and we appreciate that so much. Thank you. Yes.
Can I ask a question real quick?
Sure.
You mentioned that child mortality number that were being served by DFACs.
Yes, sir.
Where was that in the slide?
Number 8, sir.
That just seems that's grown exponentially.
Yes, sir. Senator Miller, these are not just these are not all the cases of child fatality and serious injury that DFACS deals with. These are the ones that they're working with our office to help them resolve. So these are the ones that seem to have issues that the Office of the Child Advocate could apply expertise to and help them. But even so that ask from the Division of Family and Children's Services has grown over the last 3 years. And we've seen a lot of success in the expertise that OCA is able to bring to help provide interviews of DFACS staff, things like that.
I'm not challenging you. I want to advocate for you to make sure that you have the proper manpower to cover this. But we had 11 cases in 2019, and 2 years later it had grown by 5 times.
Yes, sir. The part of that, though, is that the program, the specific program that we're using in order to do these audits was relatively new, and it just started in 2019, 2018, there was a training phase going on. But you can see that even over the course of a time when a lot of the state was more or less shut down due to COVID, we were still receiving an increased ask for assistance in those. So yes, sir, it's a growing and important area of our work.
Do you have any feel for the trend today? I mean, is this continuing to grow at that pace? Because we'll have 500 in two more years.
I can't make an educated guess right now for what 2022 is going to look like because we're so early in. I can say that I've had to ask my two investigators who do this work to scale back the number of cases that they're assisting the division with so that we can get our baseline investigative work still handled in a timely manner.
Does this represent a calendar year or a fiscal year?
This is a calendar year.
Okay. That is frightening.
Yes, sir.
Thank you. Thank you, Mr. Chairman.
Yes, sir. Thank you, Judge. Appreciate it. And
Thank you, Mr. Chairman.
okay,
Thank you,
appreciate
members.
So we've been going in reverse order here as we did with amended. We're alphabetically here, so we're up to Department of Human Services. And then Georgia Vocational Rehab. Yes, and unfortunately the mic on the left, my left, is the only one that's working, so. I think you're good. The floor is yours.
Okay. All right. Good morning, Chairman Watson and committee members. I'm joined today by my Chief of Staff, Craig Foster, Deputy Chief Chris Hempfling, Deputy Commissioner for Financial Services, Demetrius Taylor, here at the table with me, and DFAC CFO, Cliff O'Connor. And we're honored to present the House's changes to the Governor's proposed FY23 budget for the Department of Human Services. For the sake of time, I will not go through each program budget specifically for the Governor's proposed workforce initiatives, but I'll again emphasize the department's deep appreciation for the $5,000 pay raise and related benefits to reward employees for doing more with less, even in a pandemic.
Just, I'm sorry, interrupt you. We're on our tracking sheet, page 25, just for the committee. That's all. Thanks.
Sure. Using the Let's see. So we'll start for ours on page 17 will be the first change that we reference. So on page 17, we're looking at the after-school care program budget. On line item 181.1, the House has proposed reducing the budget for COVID-19 related learning loss and after-school programs by $4,727,964. The House Budget Office has explained that this change recognizes over $977 million in federal funding already dispersed to our state and local education agencies from last year's American Rescue Plan. Most of this funding for our agency was recently contracted for services through the United Way, but if this subcommittee agrees with the cut, we will cancel the contract in accordance with the legislature's will. Now, directing your attention to the Child Abuse and Neglect Prevention Program budget on page 18, line item 182.6. You'll see an additional $200,000 for services to at-risk girls. Based on what we've learned from the House, this appropriation is intended for a new contract with the PACE Center for Girls based in Bibb and Peach counties, aimed at preventing young women from dropping out of school and getting involved in our juvenile justice and child welfare systems. Ideally, this funding will nearly double the number of young women served by PACE on an annual basis through other funding sources currently. Next, on pages 19 and 20 for child support services, starting on line item 183.6. You'll see that the House has added $1,059,674 to increase the hourly rate of our child support special attorneys general, going from $57.50 to $77.50 per hour. And on line 183.7, you'll also see $44,153 for SAG paralegals, with this appropriation raising their hourly rate from $25 to $40. Going to pages 20 through 22 for child welfare services. On page 21 in this program budget, the House has agreed to the governor's recommendations for several new initiatives, including on line 184.6, community action treatment teams, on 184.7, an autism assessment pilot in Region 12, and on line 184.8, autism respite care. I discussed these in the Joint Appropriations Committee hearing, but I'll again highlight our goals given the need and excitement that we have about these efforts. Line 184.6 would designate state funding to create healthcare strike teams for youth at risk of entering foster care or already in foster care to receive in-home therapies to address their health needs, especially mental and behavioral health needs. As we continue to see more youth abandoned to state custody or ordered into custody from the bench when the youth's health needs cannot be handled at home, this new funding will allow us to pilot strike teams to ideally keep a family intact or otherwise empower a family with the tools that they need for reunification. Line 184.7 would allow for a partnership with Dr. Michelle Zena, a physician in South Georgia who specializes in behavioral health, particularly behavioral disorders like autism spectrum disorder, as well as Georgia Southern University, to better understand the prevalence of autism among youth in our custody in Region 12, which covers Bryan, Bullock, Camden, Chatham, Effingham, Glenn, Liberty, Long, and McIntosh counties. Their findings would be published and provide key insight into an anecdotal belief that the prevalence of ASD among youth in foster care is higher than that of the general population. And these findings would allow for longer-term planning by state officials to marshal resources to diagnose and properly treat children with autism sooner. Along the same lines, line 184.8 proposes new funding for our agency to contract with providers for autism respite care, specifically to ensure more intensive therapies for youth with autism, but also to prevent caregiver burnout, which unfortunately can result in a youth's abandonment to state custody. The House has also added some new funding in this program budget. I'll start with line 184.9, where you'll see $200,000 to expand our state's court-appointed special advocate program. This recommendation recognizes increases in the number of children that these individuals now serve, and it restores $36,000, the FY20 budget reduction to the state CASA Network Administration. On line 184.10, you can see that the House has added $6 million to increase the hourly rate of our child welfare special assistant attorneys general from $57.50 to $77.50. And on the very next line, there's $250,000 to increase the paralegal hourly rates from $25 to $40. Now moving to the departmental administration program budget on page 24, line 186.7. You'll see that the House has proposed a funding transfer of $4,120,000 to the Elder Community Living Services Program for Alzheimer's and Dementia Services. This appropriation reflects our existing Georgia MemoryNet program, which is comprised of 5 memory assessment clinics to diagnose and treat Alzheimer's and related dementias in Albany, Atlanta, Augusta, Columbus, and Macon, all managed by Emory University. This transfer simply moves state funding from one program budget to another. Moving to page 25, line 187.6 for the Elder Abuse Investigations and Prevention Program budget. The House has included $10,873 to raise the hourly rate for our Aging Services Special Assistant Attorneys General, going from $57.50 to $77.50 per hour. And on the next line, you'll also see $453 to raise their paralegal hourly rates from $25 to $40. On page 26, in the Elder Community Living Services Program budget, on line 188.5. The House has included $1,253,040 to create a dementia care specialist program for statewide dementia screenings. Based on what we've learned from the House, this recommendation was proposed by the Alzheimer's Association so that each of our agencies, 12 area agencies on aging, will have a dementia care specialist to improve care coordination, enhance data collection, and identify potential service gaps to guide future programs. In addition, this funding is proposed to cover an employee in our agency's Division of Aging Services to oversee those activities, assess data, and write policy. Moving to line 188.6, you'll see $3 million in new funding to expand the Georgia Memory Net, specifically to cover program growth at all 5 of our clinics to the tune of $420,000, establish a new statewide hub at $875,000, build 2 new brick and mortar locations to increase access for $700,000, enhance technology infrastructure for $700,000, create a telemedicine diagnostic site at $260,000, and set aside $45,000 for state staff. And that breakdown is just information provided from the House Budget Office. Based on a recommendation from the Council on Aging, on line 188.7, you'll see a $3,999,692 increase in state funds for non-Medicaid home and community-based services. The Council and many advocates have requested this funding to serve more clients, which we estimate could cover between 1,700 to 1,800 additional people. Now moving to page 30, line 191.2, in our out-of-home care program budget. You'll see that the House agreed to the governor's recommendation for a 10% provider rate increase, totaling $27,810,584 in state funds to increase the daily rates that we pay for child caring institutions, child placing agencies, foster parents, and relative caregivers who have our children in their homes. On line 191.3, the House has directed that we utilize $6.7 million in existing funds to improve the continuum of care for youth in custody, including preventative and therapeutic services, as well as tailored health care for youth with complex needs. On line 191.4, the House has proposed $3,025,000 to increase the annual foster care clothing allowance by $275 per child. Finally, moving to the Family Connection Program budget on page 34, line 197.1, you'll see that the House has added $815,500 to increase operational support and each county's allocation to $52,500. And with that, I will conclude my remarks on the House's changes to the governor's proposed FY23 budget for the Department of Human Services, and we'll be happy to take your questions.
Seeing no questions, thank you. Okay.
I did want to ask one question
Sure.
Quickly.
Okay.
And that is, we flipped through these pages at warp speed, but it's when they transferred money from the administrative part of your department. How much was that?
4.1 million.
How are you going to address that? What do you have that kind of soft money laying around, or what you going to cut staff, or you going to? I mean, just how's that going to look?
No, ma'am. So that current amount is just contracted for Georgia Memory Net now. It just happens to be in that specific program budget.
So
by
it's-
moving it to a different one, there will
It's
be
just
no
strictly-
issue.
I understand. All right. Thank you very much.
All right. Chairman Burt.
I'm sorry.
Thank you, Mr. Chairman. The 188.6, I think in your remarks you said something about new buildings. Yeah. Can you know any detail about that, or?
At this stage, no. To be honest with you, I think what we know that the discussion about expansion of the Georgia Memory Net's capacity has been an ongoing discussion, I think, for at least a few years now. In state fiscal year 21, those clinics served nearly 1,000 patients, and so they are incredibly helpful in those early screenings for dementias and follow-up services. But I think at this point, we are still trying to gather more information on the breakdown of how it's envisioned to utilize that funding. And part of it was that we heard that there was a desire for 2 more brick-and-mortar locations.
Okay. If you would keep us turn there, if you don't mind. Mr. Chairman, I got one more follow-up.
Got one more, but I just remind the committee, we got 3 more presentations and
Okay.
we're short on time, so that's, thank you.
Be very, very brief, Mr. Chairman. On the 188.7, if you could get me some background on what those are and whether they're theoretically medicatable or absolutely impossible. So just when you have a chance, we don't have to get into it today.
Okay, I can give you a detailed breakdown, but
All
it's usually, it's congregate meals, home delivered meals, those kinds of services.
Okay, thank you.
Thank you so much. We appreciate that. Yes. Yes.
I would just like to thank you for your work. This is a area that's been, I think, neglected, and I love the work you're doing and the investment, not only in the brick and mortar, but in the people. Thank you.
Thank you, sir.
Thank you. All righty. Georgia Vocational Rehab is up. All right, so I apologize to my committee. I did not realize that we were not at a hard stop at 11, so you can just take as much time as you want to.
No.
We both have other meetings.
I'm just funning, you know that, all right? Go ahead, thank you. Thanks for being
Chris,
here. Appreciate it.
Thank you. Chris Wells with GVRA. I have to my left Jonathan Buxton. He's our Director of Administration. GVRA's budget for FY 2023 is pretty straightforward and fairly quick. It begins on page 34 of the Senate document. And approximately 3.7.
What you know, I discovered a minute ago that sometimes our numbers are not the same. So if we can do the line there,
Okay.
Which number are we?
Okay, so we start on 198.1. Are you? Okay. 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 Most of our changes in the business enterprise program, which is 198.1 through 198.4, is just general statewide and enterprise changes. There's no operational changes in that particular program. Our next program, which is admin, which starts at 199.1. Again, you see our general statewide spreads related to the governor's initiative and the 5,000 increase. There are no operational changes, just general our statewide spreads again in our admin program. And again, that runs from 199.1 to 199.6. Our next program, which is Georgia Vocational Disability Adjudication Services, that's a federally funded program, so there are no changes in that particular program, and that starts at 200.100. Our next program, the Georgia Vocational Rehabilitation Agency, GIB program, again, no changes there. They have no enterprise changes due to the fact that they are fully funded with products and sales. Next, we can go to our Georgia Vocational Rehabilitation Agency VR program. And a lot of those changes start at 202.1. And again, if you go to 202.1 all the way down to 202.6, those are our general changes, enterprise changes that were passed out through the agency. And that includes, again, the 5,000 for the increases, the 40 hours for annual leave, ERS adjustments, TRS adjustments, TeamWorks billings, as well as a reflection in agency premiums on various other services. Our biggest changes actually start in our VR program, starting on line 202.7. and you'll see on 202.7, it says provide funds for capital. The governor's office initially provided 4.3. We have quite a few state-owned facilities on our Reservoir Warm Springs campus as well as our Cave Springs campus, and that 4.3 was kind of designed to help us kind of bring a couple of our facilities back online so we can serve more individuals. We do have some asbestos issues in a couple of our areas that we want to bring back online, and so that 4.3 was designed for us to be able to start pursuing some of those major projects. The House zeroed that out in order for us to use existing bond capacity. We do have approximately 3 ongoing projects going on right now. We fully executed those 3 projects to date and currently are spending down on those particular bonds that we received last year. 202.8 is restore funds for independent living services. Currently, GVRA works with our 9 centers of independent living. During the FY 2020 budget, we redirected, we work with them with our federal funds to match those funds and then pass through our Part B to the 9 SEALs. GVRA entered into a subsequent agreement with our 9 SEALs to provide some additional independent living services during the 2020 year. 2021 year, we redirected those funds internally to be able to execute some agency initiatives during the pandemic. So that $200,000 there would bring our independent living services back to their FY 2020 contract amounts. For 202.9, which is provide funds for the Georgia Commission for Deaf and Hard of Hearing, they may be in the room. I'll let them be able to speak more to that particular ad, but we'll be able to work with them for the $20,000 with the operations there. And in 202.10, basically providing funds for the support of opening up our priority categories. As part of the 2020-2021 year, GVRA has 3 priority categories, categories 1, 2, and 3, which we designate our clients that we work with in order to go through the agency reorganization coming into the agency, as well as execute and serve those individuals that are most vulnerable, which is our category 1. We closed down categories 2 and 3 of January 2021. The $2 million there will help us be able to draw down an approximate additional $8 million in federal funds in order to allow us to open up priority categories for all clients and individuals that are coming to the office to be able to be served. So that would again allow us to open up categories if signed to be able to move forward July 1 to start serving individuals in all 3 categories. And then our last adjustment or our last change is 202.11, restore funds for Georgia Radio Reading Services. This was also another contract that the agency had in place prior to 2021-2022 fiscal year, and the $54,000 would bring them back to the pre-pandemic levels in our subsequent agreement that we have with the agency. This includes the FY 2023 ads for the Georgia Vocational Rehabilitation Agency.
All righty, questions? Okay, thank you so much.
Thank you.
Appreciate it. Department of Public Health.
Stuck together.
All right.
Thank you, Mr. Chairman,
Yeah,
and
thank
members
you.
of the committee. Really nice to see you. I wanted to acknowledge belatedly Mr. William Bell, who's our CFO, as well as Megan Andrews, who's in the audience, who have helped me enormously, not only in the pandemic, but particularly with this budget. So thank you. The first slide is something you've seen often, and it's the map of the public health districts and the counties. And we are just such an unusually structured agency for public health nationwide, in that we have 18 public health districts that are part of the state office, with 18 health directors reporting to me as the commissioner, but 159 independent county boards of health who are overseen by the district health directors. And so we have a hybrid but I think interesting structure that has, if anything, become more unified during the pandemic, which is a good thing. But the reason I wanted to emphasize that is if you look at the statewide changes, that I'm very grateful to Governor Kemp for the additions that were added, the $5,000 for all staff. If you look at those, you'll see that, in fact, the Board of Health employees, so these are not state employees, but they are our boots on the ground in the counties, are also included in that $5,000 increase, which is just a really wonderful opportunity for us to improve our staffing salaries. And let me just move on now to the House budget recommendations. Let me start with recruitment and retention of the public health workforce. And I have to tell you that in my many years in Georgia Public Health, this is perhaps the most important budget item I'm ever presented, because it actually brings many of our most important salaries that not only have been functioning every day in public health, but particularly those who responded to the pandemic, up to market midpoint, and that's specifically nurses and epidemiologists and other positions such as environmental health specialists to at least a competitive market range. And as you heard from some of the other agencies, we have, compared to other states, compared to other agencies like ours, lower salaries than most. And I think this has always been a problem with recruitment and retention, but has become particularly acute during the pandemic, where we saw county-level epidemiologists leave. About 42% left during FY21, and we're able to get the 50% increase by going to an adjacent school district. Additionally, public health nurses, about 28% left during fiscal year 21. We've currently vacant about 70 environmental health positions. And so I want to emphasize that this increase for recruitment and retention that was put in by the House does not affect all 6,000 public health employees, but only those whose salaries were specifically underfunded. And these, it just happens that the majority of these were those that were responding to the pandemic: nurses and environmentalists, and the epidemiologists. And so about 1,400 of those are actually at the county level, and only about 200 at the state. So this disproportionately will affect, local public health in a very, very positive way. And we are very optimistic that with this increase and with your support, we'll be able to not only continue our response to this current pandemic, but perhaps just as importantly, be prepared for the next pandemic, as well as ensuring the entire state is safe and healthy across all aspects of our program. So I spent too much time on that, I know, Mr. Chairman, but I was just very grateful for the House's support, and just wanted to emphasize my enthusiasm for their generosity. Moving on to our program budget items, 244.1, pilot program for high-risk pregnancy populations, and I'm going to also talk about 244.5, another pilot program. This is also for high-risk pregnancies, particularly echocardiograms for pregnant and postpartum women. I want to take these as a kind of as a single item in a sense. Both are contracts with AU working in partnership with us to address maternal mortality, specifically looking at finding high-risk women who might be at risk for things like preeclampsia, for complications of pregnancy exacerbating existing cardiac complications. I'm in talking to Senator Burke, he's the expert. I should let him present this as an OBGYN. But this is incredibly exciting, because we can see an opportunity to do these two pilots to ensure that there's outreach, follow-up, interaction with some of these high-risk women for their prenatal and postpartum care, and address some of these underlying health conditions that have led to disproportionate impact on our maternal mortality. So we are very enthusiastic about this. Chad Ray, who oversees our prenatal care programs, working with public health. We have a kind of a pilot public health prenatal care program. He is very engaged in this as well, and we have talked at length about how this will work together and how we can ensure that these two programs plus our public health maternal mortality programs are working in tandem to maximize the impact of this investment. 244.6, Sickle Cell Foundation. This is a kind of a dual role. Will be able to expand, or the Sickle Cell Foundation will be able to expand access to testing in rural areas. As a reminder, we do sickle cell testing with newborn screening, but we in our laboratory do not offer that. So this will make that testing available, particularly in areas where it isn't easily available or that may not be covered by health insurance, and additionally provide seven workers to do coordination of care, and this will all be to the Sickle Cell Foundation. 247.5 is the Georgia Coordinating Center. Again, a reminder that this was initiated, at least in the metro area, when Grady Hospital had a leak, and several of their wings were unable to be used, and there was a shortage of beds, and the coordinating of EMS to other hospitals to ensure the right levels of care could be provided. Recognizing that this was certainly an optimal way to do business during the pandemic, you and the House had continued to fund that in the metro area. We also have seen that there was significant problems statewide, both with being able to take individuals with COVID to the appropriate care hospital, and also the wall time that we saw particularly during the Delta wave that we had last year's. So we are hoping with these additional funds to have this entity fully funded. It's a partnership with Grady, but it's a DPH partnership, and are hoping to expand that access statewide. The McIntosh County Ambulance Equipment and Repair, this is a one-time funding. The McIntosh County is planning to get their own, if the county itself plans to support their own ambulance service. They have already invested a considerable amount of county dollars, and this will be a one-time funds to buy an ambulance and other equipment to allow them to do that. 252.4 is ADAP. We've talked a lot about that. This 9.9 million, 884, which was in the governor's budget and supported by the House, will allow us to stabilize our program budget, to continue to bring on additional clients, particularly as we're coordinating and better managing this program with your input and your help, as well as help from the HRSA, who has given us oversight and guidance on how to do that. We have additional individuals on the insurance program as well as ADAP. With this additional funding, we can stabilize that program, ensure that it can continue to grow, and that we can avoid a waiting list, which is incredibly important. The 3-year, the final year of the PrEP, or the pre-exposure prophylaxis pilot, is $45,709. That's $252.5. This was a pilot project that was to look at pre-exposure and prevention of HIV. It was located in 2 counties, Haralson and Towns. It didn't get quite the start that we were hoping because of COVID. Many of the staff involved in this were redeployed to contact tracing and other activities. But both those county health departments have initiated that work, are working diligently to get additional partners on board to do outreach and then link that outreach to availability of PrEP. And we will hope to continue and end this project this year with a report at the end. I'm very pleased to present 253.4. These are lead inspectors and testing machines. This particular item put in by the House is the result of recommendations from the House Study Committee on Childhood Lead Exposure, House Bill 1355. I want to thank ahead of time Senator Watson, Chairman Watson, for being willing to introduce this bill in the Senate. This bill provides each health district, so 18, inspectors as well as the equipment to be able to test for lead in the household. And why this is important, we as a state did not recognize lead poisoning in children until a child had a lead level of 20 micrograms, which is quite high. And so there would already be significant brain damage potentially. And the recommendations from the study committee last year was that we actually would lower that threshold for intervention to 3.5. So we were 6 times higher than the best practices. And with that change, we will require some additional staffing, which is what this 253.4 is. And the last item, 254.6, grants to counties, infrastructure and support. This was added because Dawson County Health Department needs to be replaced. The county hasn't invested considerable amount of money and of their own as required in statute. They needed some additional funds, $1.2 million to complete the project in the new health department in Dawson County. And $500,000 is needed by Clay County to do mitigation for black mold, which is has prevented them from using that county and that health department that is so really needy of health care and particularly relies on our public health role. So those are the items in the House budget, and I'll be happy to answer questions.
You do have some questions. We're going to go to my right first, ladies first here.
Thank you, Dr. Toomey. Just on the maternal mortality
Yes.
pilots that you're working on, is it safe to assume that you're coordinating with Department of Community Health, since they have a lot of these folks in their programs through Medicaid, and also the Office of Health Strategy and Coordination
Right,
through the governor's office? I'm always paranoid that we are too much in silos on that particular subject, and hoping that you guys are coordinating with those agencies.
No, I know the Office of Health Strategy has made maternal mortality a priority, and we have not yet begun working with these, and we, of course, will be working with DCH because many, if not all of these women will now be on Medicaid, and with that potential expansion will be even more important because we'll be able to follow them longer.
Thank you, Chairman Burke.
Thank you, Mr. Chairman. And to help answer Chairman Kirkpatrick's question, that line item of the 244.5 was actually in the DCH budget, but we felt like it was a better program and better fit with what they're doing in maternal health in DPH. So that's why it's been shifted over here, and everybody is on the same page that's appropriate. And I appreciate your comments because of in my mind, those two pilots there need to be probably blended into one, and that's will probably be our recommendation But
Just maximize the.
the other piece of that I would certainly ask for this subcommittee support on is the funding in that grant that was put in the governor's budget. And I want to thank Governor Kemp for that. That makes that a lot easier when that money is there rather than us having to find it. But to make this an effective pilot, I think it needs to be widened to a couple of other communities as it's currently funded. We're probably talking about the Augusta area, and I'm trying to build support to broaden that to the Albany and Central Georgia area, to kind of what I call the stroke belt, which is also the highest levels of maternal mortality in Georgia. So again, Mr. Chairman, just look forward to working with you and the subcommittee trying to make that pilot be as effective as it possibly can. The other one I wanted to mention is I've just had a fair number of calls on the coordinating center, and I've been in touch with your folks, and we're going to have further conversations about that. I think it's a great idea, but we've got so many other things going on. We need to make sure it's executed well. So. And then
Can't agree with you more.
Okay. And the last thing I want to mention is the lead exposure. There are other heavy metals out there that are probably causing problems too. I know in maternal health that's a consideration. Is there any work being done besides lead as far as that part of your programs?
Not that I'm aware of, but the inspectors could certainly be looking at other aspects, particularly as they're going out and addressing newborns and as well as potentially prenatal patients as well.
Okay, thank you.
And that's a great idea, actually, to do so.
All right.
Thank you. I know we're short on time. Those are life-saving ads that we've just been discussing, and I've got a lead issue right in the heart of my district, right by public school. I just want to thank Dr. Toomey. This endless challenges to public health, having you at the helm, has made an incredible difference, and I know it's a great personal sacrifice to survive and thrive in the climate that has been visited upon us by the pandemic. Thank you.
Oh, no, thank you so much. I just want to, again, a shout out to the public health team statewide. A commissioner can't fight a pandemic alone. It really takes a very large public health village to do it, and I really want to acknowledge that collective work.
And thank you so much. It takes a good leader at the top, and you've certainly been that. We appreciate your work, and look forward to continued working with you.
Oh,
right.
Thank you.
Thank you so much.
I'm not wearing a brace either. I did that just for you.
All righty. Next up is Department of Behavior Health and Developmental Disabilities. So one spotlight to the next.
We're stuck together. Just like we like it.
Go ahead.
Good morning, Mr. Chairman, members of the committee. It's great to see you this morning. Very happy to have the opportunity to present the FY23 budget for DBHDD. I'm mindful of time this morning, and we've got quite a bit of ground to cover. Let me just check in with you, Mr. Chairman. What's your pleasure this morning? We have quite a large number of House ads. Would you like us to go through everything? Or
Why don't we go through the changes
Okay.
just as quickly as possible, and if we get to be a time frame, I'll let you know.
Very good, thanks. I appreciate that. Okay, very good. I believe you have our slides before you, so I'll start with the first budget slide that you see, the statewide and agency-wide slide, and I'm just going to speak to the two first items on this budget, and then also just remind you, we've got a color-coded rubric here, and what we've tried to do with every budget item is tell you what issue it is that we're trying to address. So we've maintained that here, just so you know what we think this this budget item will do. So of course, item number 1 here is Governor Kemp's recommendation for statewide cost of living adjustment for state employees with the intention of reducing turnover and supporting retention. The House just made a minor fiscal adjustment to this amount here. I do want to speak more specifically about item number 2. Here you see a $20.2 million ad from the House to increase hospital salaries in 2 categories. First is psychiatric nurses, and second is what we call health aides, health service technicians or forensic service technicians. Just a word about this investment. You may recall that I've reported that since the beginning of the pandemic in our hospital system, we experienced a loss of 1,116 hospital employees. So just like every other healthcare entity, we've had a large number of staff departures, and now we're facing stiff market competition. I want to be clear about how it is that we have kept the safety net hospital doors open. Really twofold strategy. First, we purchase private psychiatric beds. Second, we have relied on the staff augmentation from Jackson Healthcare with support from Governor Kemp. This has been vital to keeping our doors open. However, as we return to normalcy now and we work to move away from that augmented staff, these salary increases will be vital, we think, to being more competitive in the market, very specifically in these areas where we have the greatest amount of turnover. So we're excited about the possibility there. I want to be really explicit what this will do so y'all are aware. I'll give you the 2 categories for nurses, for example, for LPNs. This would take LPNs who are at a starting salary of $36,000 up to $42,000, and for our health service technicians who have currently a starting salary of $24,000 up to $31,000. These are some of the hardest jobs in state government, and we think this will be an important element of building our workforce for the future. Okay, next item. You'll see here, and again, I'll just pivot to where the House has made adjustments. Y'all are very familiar. Now I'm going to move to 58.8 on your tracking document. In the area of adult developmental disabilities, very specifically our now and comp waivers, which allow individuals to live in the community, there was an annualization, but the addition from the House, on top of the 100 now and comp waivers that were initially in the governor's budget, the House has added an additional 225 now and comp waivers for $6.5 million addition. That would take us to 325 waivers. And I do want to make a note here, that would be the largest number of waivers we've ever put in the budget. And this is certainly an area of interest to the Department of Justice as it relates to our settlement agreement. They look to this to see, this is an example, I think, of Georgia's sustained commitment to help individuals with intellectual and developmental disabilities live in the community. Alongside of that, again, in adult developmental disabilities, 58.10, you see a 1%, the House has added a 1% rate increase for intellectual and developmental disabilities providers. Now, those providers are experiencing the same staff shortages that we are, and this 1% would be on top of the 5% that y'all already approved. And then just one point to note, I think y'all are aware, anytime we have a rate increase, it has to be approved by CMS. But again, we know this workforce is in need of support at this time. Final item in this category, 58.12, you'll see a 5% increase from the House for non-waiver family support. So these are individuals and families who have not yet received the waiver, but they are eligible for what really are flexible funds, so that we can assist qualified families. We think there are probably about 370, and help caregivers and families in the home who may be in need of education, social support, respite services. And so that would be an addition there. Okay, I'll move on to the next slide. And the first change item that you see here is 59.5, the 15 forensic peer mentors. This was a true-up, a fiscal adjustment from the House, but just a reminder, this is a partnership with the Department of Corrections, where we have forensic peer mentors who work with individuals with mental illness who are discharging and working towards reentry in the community. Forensic peer mentors help them and have played a critical role in reducing recidivism. The final item on this slide, 60.12, the house change here. The house change here is actually a reduction. What you see is this is in relation to assisted outpatient treatment programs, AOT, and there's been a lot of public narrative about this. This is really referencing individuals with serious and persistent mental illness who are cycling in and out of community services and have not yet achieved recovery. So these programs, the House adjustment here is to allow for staggered implementation of the proposed pilots. And DBHDD currently has an active pilot underway in Muskogee County. We're learning a lot from that and really feel like the importance of this program is to align with the evidence-based practices. So the staggered implementation will allow us to ensure fidelity to the model there. Okay, moving to the next slide, again focusing just again on the House adjustments. Item number 2 on this slide, 60.6 on your budget tracking. The House made an adjustment to the Georgia Housing Voucher Program, GHVP. And on top of the governor's budget, which had 200 new vouchers, the House has added an additional 300 housing vouchers for a total of 500 vouchers. Once again, this is an area under deep scrutiny in our settlement agreement with the Department of Justice, and this would be further evidence of Georgia's sustained commitment for individuals with serious and persistent mental illness to participate in this really nationally recognized housing voucher program. Right alongside of that, 60.13, you also see the addition of a network manager for the program. As we have enrolled more people in housing voucher, we've also seen a need for additional management of payment and really working with landlords around how to make this program successful in the community. You also see there 2 additional notes from the House related to the AOT program, 60.14 and 60.15, where there is the establishment of an AOT database for individuals to be served there and establishment of an AOT oversight unit, the House addition there for $238,000. I'll go ahead and move to the next slide, where there are a number of House additions. The first one, 60.16, you see in the area of adult mental health, co-responder expansion to 5 new sites in the amount of $448,000. That would simply expand some of the work that's already underway with co-responder pilots. Once again, co-responder is a pairing of a behavioral health provider and law enforcement, and really designed by the local community in those cases. The next House addition is funds for a new 16-bed behavioral health crisis center that would also include 50 temporary observation. This would be our most modern treatment facility, the behavioral health crisis centers. This is an addition of $9.7 million for that behavioral health crisis center. Also, the next 3 items, 60.18, 19, and 60.20, are all in relationship to mental health accountability courts. So you see the addition here of 5 new additional staff persons. In the first one, an increase in people currently working in the mental health. That's a 5% salary supplement for 12 employees already working in the mental health accountability courts. And then finally, you see the establishment establishment of a technical assistance coordination center for the accountability courts in the amount of $220,000 there. Okay, moving on, next slide. Again, House additions. First item here is for an increase in funds for the GCAL support staff in anticipation of the implementation of 988 in July of this year. And with the expected volume increase, the House has added $2.1 million to accelerate our preparedness for 988 as it rolls out this summer. The second item here, 60.23, you see a House addition of $6.3 million, and this is for an 18-bed adult medical psych unit at Grady Hospital. And I do want to acknowledge this is currently a gap in the system where we have individuals with serious and persistent mental illness who also have significant medical needs. This would be filling a void that we currently experience in the system. And this would allow the purchase of the reservation of beds for uninsured individuals in that Grady setting. Item number 3, you see a House 60.24 one-time funds for a behavioral health rate study in the amount of $932,000. I think y'all are aware we have a rate study underway for the delivery of intellectual and developmental disability services. This would be for behavioral health services, and the rates we're working off of right now for behavioral health are from 2006. So this would certainly be an update of our rates in that area. Items number 4 and 5 here. This is 62.4 and 62.6. These are House additions for specific providers. 62.4 is for ESP, Extra Special People. That's a nonprofit serving individuals with intellectual and developmental disabilities in Watkinsville, Georgia. And 62.6 would be to provide funds. This is actually a restoration of a cut from FY21 to the Matthew Reardon Autism Center. Okay, final slide. With highlight of the additions. The first item here in child and adolescent mental health, you see the House has added $5.6 million. This is item 64.4, and this is to annualize funds to maintain the Georgia APEX program. I think many of you are familiar. APEX is our school-based mental health program. We're currently in over 715 schools. It's been a lifesaver during the pandemic in reaching youth with mental health concerns in school-based settings. The next item, the next two items, 65.6 and 65.7 are adjustments to the SAG rates for the attorneys and the paralegals. You see these two items. DBHTD has a small utilization of those two, but this suggests a increase in the hourly rate in both of those areas. Item number 4 on this slide, another area of departmental administration. The House has added $261,823. These are funds to implement the terms of the National Prescription Opioid Litigation Settlement. Of course, there's an expectation that there will be a large number of opioid settlement dollars that come into this state and every state, and this would be administrative support to ensure timely and efficient allocation of those funds throughout the state as they come into the state, since DBHDD serves as the state opioid treatment authority. And then the final item here, item number 5, 66.6 on your tracking document. There's a House adjustment here. Originally in the governor's budget, this was a $5 million item. This has now been adjusted to $3 million. Direct care and support services is in reference to our hospital system. So this is capital maintenance and repairs across our 5 state hospitals. You all have become familiar with the fact that these are not 5 buildings. This is actually 400 buildings, over hundreds of acres of campus in regular need of restoration and repair. So these funds would support continued needs across our hospital system. So that is a whirlwind tour of the House additions and specific budget items there. So happy to answer questions that you may have.
To my right, Senator Kirkpatrick.
Thank you. Going back to the now comp waivers, we've been chipping away at that, and this certainly is a big bump. What's the denominator? Where are we with the overall program?
We still have, so currently, we serve over 13,000 individuals on now and comp waivers. The planning list is somewhere around 7,100.
Senator O'Rourke.
Thank you, Mr. Chair. Thank you so much for your presentation. And just doing the math on that 7,000 on the waiting list, we with the House ads, it's 500 waivers that are going to be slots that are going to be. Did I misunderstand?
No, I'm sorry. Let me clarify. Governor Kemp originally had 100 in the budget.
right.
The House has added 225. So the
okay.
total would be 325.
325. So we're at the rate. We'd love to see that trend line continue of upping the slots that are funded each year. On your last slide, the funds to maintain the Georgia Apex program, that's the school-based, and that's covering, you say, 750 public schools?
715 currently.
715.
Yes.
And what? How many are left uncovered? I mean, what's your reach?
I don't have that number of how many schools there are. What we know is, let me just say a word about
What penetration rate is that?
Yeah, that's a good question. We can get you that. All the schools there are. Let me say this. We invite schools to apply, and if schools are interested, and this has been middle schools and high schools, they've got to partner with their local school system, because this really only works, we've learned, when the local superintendent, and we ask them really to identify the schools where we think the greatest needs exist. We've had 58% of the schools have been rural schools, particularly focusing on areas where there may be access challenges. So we can continue to grow that and build. It's been really popular. I'm happy to say in this last pandemic year, a third of the students that we reached, it was the first time they had ever received mental health services. So I think that we're really reaching and identifying kids where they are in school settings at the time they first raised their hand for support.
Just offline, to get more information.
Sure. Be happy to.
Senator Burke.
Very briefly, Mr. Chairman, the House was, I guess, very generous to add funding for HB 1013 that's kind of flowing through the process. Having reviewed that bill a few times, I think the accurate funding is probably not adequately addressed in these numbers. I guess if you guys would be working on that and letting us know in your mind what you feel like it would truly cost this subcommittee to make that happen, that would be helpful.
Thanks for the invitation.
Okay.
And you see, we've tried to note here anything that was specifically
that's
related
very
to
helpful. Thank you.
1013.
Right. Those bills, they've not passed yet, but I think we're all certainly optimistic. And for instance, the co-responder portion of that, so we'd like to circle back on that and discuss that. Thank you.
Be happy to.
I think that's it for questions and for testimony, and we appreciate that.
Thank you, Mr. Chairman.
Meeting's adjourned.
Thanks to Caitlin.